considering that residents are getting several different offers and trying to make their final decision, what led you to accept your residency within Excella and move forward with your final decision, Dr. Pacheco?
So I chose Excella, and I apologize if I haven't correctly answered the question. I chose the program, the residency program I chose, and I'll take a step back and say that I had an offer to a program that was very highly academic in Atlanta, and I picked the program in Latrobe because it was unopposed. There were no other residents there. I got very dedicated teaching from all walks of life, from specialty to primary care to really even administration in the hospital. And it was a smaller group of people. So I was really fortunate to get every and any experience that I wanted. So I picked an unopposed residency. When I was in general surgery, it was a multi-residency program. So there were family medicine residents, gen surge, internal medicine, GI, you name it was there. But when you're in an unopposed program, there's no one but you. So when it's a GI bleed, it's you. Or, when it's anything, it's you as the resident, and everybody is clamoring to give you the experience. For the most part, attendings love to teach. I love to teach too. There's nothing like a learner. So that's what went into my decision making about residency choice.
Thank you for sharing that. We appreciate it. Dr. Iqbal, considering the residents have several offers and trying to make their final decision, what are some of the tips and suggestions that you would give to these residents?
So first of all, I'd like to say that just be aware there's no perfect job out there. Okay, so you have to look at all aspects of the opportunities that are being offered to you, and just some tips on when you're interviewing. Ask to talk to different people, not just people on the panel, and then just ask them why they stay, why they chose going there, why they stay, and then what's the most frustrating thing of their job. So when I have applicants come out and we do a tour of Kaiser facilities, what I do is I introduce them to as many physicians as I can, and I will ask that for them. I will say to my colleagues, hey, tell our applicant, what's your favorite thing and why you stay here, and what frustrates you the most. So, for us, sure, there's no billing, we don't do the billing. You have to do your documentation correct, and the billing gets done. So your note has to be correct. That's easy. So, what's the frustrating thing? Well, the volume is so high, and our patients can directly email us. So some physicians have 30 to 50 personal emails a day that they have to take care of, and our expectation is within 48 hours. So, that's the give and take. So if you're one of those people that like that direct contact with your patient, and you don't mind answering some of the questions that you think are not doctor questions, then maybe we are the place for you. But if you're one of those people that you hate doing emails and that's not for you, then so look at the practical aspect of it, not just the money, the salary. I mean, those are all market standards, and they're going to be very similar in the benefits. But I think just looking at the day-to-day job, and also when you're exploring jobs, to ask working physicians, what does your day look like?
Great key points you just made. Thank you for that. And Dr. Runis, your tips and suggestions that you would give to residents that are considering opportunities and trying to make their final decision.
Sure. I mean, I think Dr. Iqbal hit that question out of the park in terms of, again, asking those tough questions in terms of, okay, one, like you said, first of all, what keeps you here and what makes you happy to be here? And then two, like, what are the worst parts of your day? Because that's not the stuff that's going to be in a brochure. It's not going to be on the website. So, I think being able to really, look at a job and holistically, the positive aspects and the warts and all, and figuring how that fits with the lifestyle that you want to consider yourself living. I think that's the main thing. Because then the other thing is I don't think that again, like with Dr. Iqbal's point, you shouldn't just chase something just because you heard it was a good thing to go to. Like it should really make sure that makes that it fits you in terms of will make you happy, because um, what Dr. Pacheco keeps saying, you're right, you're going to be doing this for the next 20, 30 years of your life. So don't take a job that you think like, oh, I'm only going to do this for a couple months till something better comes along, because then that means you're not really going to put your heart into that, and that you're going to be cheating your patients as well. So you don't want to do that to yourself. So I would just say, yeah, just take your time, and then again, listen to Dr. Iqbal's advice. I have nothing to add to that. I think she did great.
Great. One last question for you guys. You entered your careers into primary care. What led you from a practicing clinician into the leadership role? And I'm going to start with you, Dr. Pacheco.
I felt like that was coming my way. You know, I think, to be honest, I got identified pretty quickly in my and I'm seeing a lot of head shakes. You know, I got identified really quickly after I started my job. I asked a lot of questions. I talked a lot, maybe more than I should, but was always interested in the why. And so, you know, I started off with small groups where for instance, I actually started leading the coronary artery disease bundle for us in primary care. It was really interesting, across specialties, talking about, you know, industry standards and gold standard in treatment, and the expectation that primary care would have for patients prior to heading into a specialty, or utilizing specialty services. And then I, you know, moved into performance improvement. So hearing cases where we were kind of talking about what went wrong. And I really enjoyed that, actually. As an aside, surgery does this really well with their M&M conferences. And I don't know that we do them as well or do them enough in primary care, but there are certainly always areas of opportunity. In fact, you know, as I say that to you, we do our medical homes, and that's probably our M&Ms, really, right? But so I got identified that way. I honed in on organizational skills for myself, did a lot of follow-up. So I always keep a notebook. It's just my thing. I have something that I write down and I go back to and I cross off, and I'm a list maker and a box checker, and maybe that's the surgery. But I just did that. And I started to be identified as reliable and someone that, you know, you could count on. Then I got given projects, and let's see what you can do. And so I took the time, and in fact, I recently sat down as a woman leader, and, you know, what would I be saying to myself, or what's it like having come through the system as a woman leader? And I just really, you know, took my time, really was thoughtful about positions and committees and chairs that I was offered and able to take on. I said yes probably too many times, and got a little stretched at some points, but really was thoughtful about things that, again, resonated with me and felt right. And eventually was able to take on the department director. So I now was the leader for the department, and my department kicked it out of the park with quality. So I got pegged, go make it happen for community medicine. And I haven't done that yet, because it's a really tough one. But you know, just being involved, doing what you have to do, being reliable, following up on things, responding to emails. And this was a lot, I will tell you, a lot of my own time, but it was my personal investment in my future in administration and as a leader. And now I get paid to do it. So